And looks like we have met quorum with 5 of our committee members here. I just want to make sure to recognize them. Councilmember Sandra Sepulveda, welcome, glad to have you. Mr. Jose Gonzalez, Ms. Sarah Finley, Ms. Vonda McDaniel, and Mr. Sean Henry. We'll recognize any other members that join us as they do. The purpose of the COVID-19 Financial Oversight Committee is to provide financial oversight of the coronavirus local fiscal recovery funds of the American Rescue Plan of 2021. The committee issues reports upon, reviews the use of funds as it deems appropriate. Further, it collects, considers, and recommends appropriate uses of the American Rescue Plan funds as designated by the Metropolitan Council Disbursement Plan. Today, we're going to be considering $50 million worth of requests that have come through, particularly around homelessness. In our last meeting, we spent a fair amount of time going through Q&A and reviewing requests, both from the affordable housing side, which we have tabled till August, and from homelessness, which again, we will take a look and walk through today. A request was made by committee members at the time for us to break down the requests into votes, into separate votes. And so as it currently stands, and we'll review it further, but it looks like we might have 5 votes in front of us over the course of the meeting today. My understanding also is that we have a hard stop around just before 4:30 for a couple of our members that will lose our quorum. And so this is as much for our presenters as it is for the committee members. If we can, and I'll do my best to help in this, if we can move through the content efficiently. It's important, and it's a lot of funding. I don't want to rush any opportunities you've had to ask questions, but we did spend quite a bit of time together at the last meeting going through questions. We have compiled responses to those and shared those, and you will see those reiterated as we go through the slides. And so I'm going to presume as we move through that we have been responsive to date to content needs, and so slow me down, essentially, if you feel uncomfortable about the pace. We do want to make sure that you have what you need for your deliberations. All right. Very good. Well, I'm going to shift right over then through into the homelessness funding proposal. Again, this is $50 million worth of opportunities that have been brought forward. And it really breaks into 2 sections, as you see on the agenda. There's $25 million that's around deeply affordable permanent supportive housing gap program, and then another $25 million of different types of supportive services. And these pieces will break out in terms of the presentation itself. I believe our first part of the presentation on the deeply affordable permanent supportive housing gap program will be presented by MDHA, and we have Amel Alexander here. Thank you, Amel. As we walk through the slides, I will watch you. Just raise your hands if you have a specific question. Amel?
Good deal.
Want me to?
Sure, you want to prime it up?
Yeah, so thank you guys for being here. I just want to kind of set the stage because I tend to be a storyteller and use too many words, so I want to make things, just kind of pull it together. So these are all separate votes, but what I wanted to make clear, especially after meeting with a couple of the council members separately, is that they are all tied together. So the $25 million for deeply affordable housing, and deeply affordable differs from affordable housing is that it is affordable for people, households at 30% or below of the area mean income. And these are the people that wait on you at Starbucks. These are the people that are on fixed incomes, people that you run into every day that make a minimum wage and without deeply affordable housing cannot possibly afford to live in Nashville, Davidson County, and are at risk of homelessness. The rest, there's been a great outcry among the council members to make sure that we have supportive services because those are important. The units that will be set aside in the $25 million are tied to the Housing First supportive services. We need to make sure people retain their housing. The temporary interim gap housing, which we are going to use to move people out of encampments and places not meant for human habitation. Low barrier housing collective, and everybody's going to present on these separately, are the people that are going to be out there finding the landlords to work with us and leasing up some of these properties. And then competitive grants to local nonprofits are to increase those nonprofits' ability to serve these people. And so I just wanted to make sure that I just kind of set the stage in that none of these is an answer in and of themselves. All of them together are. We also recognize that we are going to have to be more active in reaching out to the state and applying for more of the competitive federal grants, all the things that are needed to make sure that money continues to flow into Nashville to assess these people and to address what is becoming an urgent need here. So I'm going to turn it over to Amel.
Absolutely.
That was short.
That's good.
Emil Alexander. I am the Director of Community Development at MDHA. I do want to acknowledge my boss, who's here today, Dr. Troy White, who is our Executive Director at MDHA. We've been asked to administer this program. We administer similar programs on behalf of the city of Nashville. So what I'll do is kind of just go through some of the program guidelines. Some of this we covered during the last meeting, and then sort of jump into some of the questions that were asked during the last period. All right, as Stacy mentioned, this is a loan program that will target affordable housing developers who have a gap in their project due to an increase in construction costs or an increase in supply costs. We're primarily targeting folks who have a low-income housing tax credit award, but we will also consider applications from developers who also have other affordable housing forms of subsidy. We are essentially asking developers to create deeply affordable housing for families who are at 30% and below. This is one of the areas of greatest need that came out of the Affordable Housing Task Force report. So this deals with unit creation. So we're asking developers to create units for families at 30% and below. These are families, so for a family of three, making $25,000 a year. In addition to creating units at 30% and below, we're also requiring them to give us a set-aside of units for permanent supportive housing. And Stacey will talk a little bit about how that will work in conjunction with Metro Homeless Impact Division. MDHA will administer the program through a competitive application process. And what that looks like is developers will apply to MDHA for this funding. We will evaluate those applications through an independent evaluation committee. We will make award recommendations to our executive director, and if they're above $1 million, our board of directors will approve the awards, similar to what we do with our home program and some of our pilot applications that we receive. Developers will be required to fill available units through the coordinated entry process and work with Housing First case management on the supportive services side for the PSH units. Loan proceeds from this program will be reinvested by MDHA annually to create new housing and supportive services. And that's the most, exciting part of this program is that we're able to reallocate those funds for additional housing, additional services targeting homeless populations. There will be a 20 to 35-year affordability period depending upon the size of the loan, and we will enforce that with a deed restriction on the property. So I'll stop there. If anyone has any questions, or if there are no questions, I'll move to the next slide.
I also want to recognize that we've been joined by Councilmember Jennifer Gamble. Welcome, Councilmember, and also by Mr. Janad Adebayo. Thank you for joining us. Any questions? Yes. Councilmember Sepulveda. Let's see if I get this right. Thanks.
The 0 to 30% AMI, what area is it? Is it a specific geographical area, or is it the county as a whole?
It's the county as a whole.
Thank you.
Can I add to your answer, just because I think it bears, so these are all multifamily developments that are popping up all over. They're all mixed income. So these are the big, beautiful new buildings that you see coming online, and there will be units that are scattered site, which evidence-based best practices say that in permanent supportive housing, scattered site housing is actually the most effective. So it really brings a tremendous amount of choice to our toolbox of interventions for people experiencing homelessness.
Yep. So overview of the deeply affordable housing gap finance program. So following the meeting we had last month, we went back with our team and developed a list of guidelines for the program based on how we anticipate administering the program. We looked at some other examples in other cities. Louisiana, there's a similar program in operation in New Jersey, and we compared it to what we already do with some of our loan programs. But based on the questions that we receive and the comments that we received today, we'll also incorporate that into our final document where we actually develop our RFA, our application materials, and our program guidelines. So question and answer. So the first question we received was, what would be the best mixture of subsidized units and permanent supportive housing units? And the answer to that question is, it's really going to depend upon the amount of funds that we invest into each project. We want to underwrite these projects on a case-by-case basis, but we will have just general maximum per unit guidelines based upon some of the guidelines we use with our home program and current cost of construction. The second question is, what happens to the funds when the money comes back? Where is the accountability and who manages it? MDHA will manage these funds when they are paid back by the developer, and we will incorporate the use of those funds into our annual action plan. That action plan goes before the Metro Council for approval before we submit it on to HUD, and we'll report annually on how those funds are used through our CAPER, which goes through our entire public presentation process, public hearing, and public comment process. All right.
Yes, Councilmember Sepulveda.
What's the payback period for the loans?
It will depend. So between 20 and 35 years, but based on the amount of the size and the project, we'll work with the developer on that.
Oh, yes. Sorry, Mr. Henry, and let's see if I get you on the right. I'm just going to click on a bunch of these.
I can yell.
Oh, there we go.
Thanks for the presentation. This is really great. On the interest amount on the loan, is that fixed over the 20 to 35 years, or is it variable based?
Whatever interest rate we agree upon with the developer will be a fixed interest rate.
And I'd like to recognize that we're joined here by Representative Harold Love. Welcome.
I didn't want to say you did that.
I'm very happy to have you. All right. Ms. Finley.
Thank you. Yeah, I have several questions. First of all, I saw the kind of amounts per unit that would be the caps, but is there a particular number of units that we're targeting here in terms of making sure there's at least X number that are developed with this program?
So it really be dependent upon the gap for each project. Whatever the percentage of that gap is for that developer, we'll probably appropriate the percentage of units at 30% based on the size of that gap. But we are anticipating having up to 120 units created through the program.
But there's not like a minimum baseline that we definitely want to make sure exists once this program has been funded?
We want to make sure we get the maximum, but we won't know until we look at the applications.
Stacy, can you speak into the microphone? Thank you.
I think that we are trying to get the maximum that we possibly can. We want a mixture of the 30%, and as Mel said earlier, there'll be set-asides for permanent supportive housing vouchers, or even the MDHA Section 8, the choice vouchers that will go into that. So it'll all depend on the mixture, but we're going to, I would assume, I don't want to speak for it, but we'll work to get the most that we possibly can. out of it.
We will, and some states do require a minimum, like a minimum of 500,000 for a gap. I don't want to lock us in that early until we see what type of applications we receive and what type of gaps we're looking at, and we'll sort of make the determination from there.
And sort of a similar type thing in terms of just what the sort of guardrails are. Is there a certain cap that we would provide to one developer in terms of just how much risk we would, allow one developer to have as opposed to trying to have a minimum number that are participating?
So right now, we're using caps that we use similar for our home program, but including a cost escalation based on construction prices. So yes, there will be a cap, but again, it will go back to the size of the gap and sort of the AMI ratios within each particular project.
One thing, I noticed that the repayment, there's sort of some give in there, and I understand that reality sometimes doesn't match expectations, but the interest rate is sort of mutually agreed, and the loan can be forgiven. And there's also a funding mechanism for 50% of a developer's surplus. I guess all that begs the question, there's a lot of discretion ultimately in terms of the likelihood that there would be repayment. I don't know how likely it is that 50% of a developer's surplus is a very large amount. What happens, and has there been any comparable experience in terms of whether or not repayment really can function with these types of parameters? And also what happens if the project is sold?
So yes, we have similar parameters on our home loans, and those are being repaid. We try to cover that on the front end through the underwriting process. So our underwriting team will look at each project, underwrite it to determine whether or not it's realistic to expect them to be able to pay back the loan based on based on the 50% of surplus cash. And I forgot the last part of that question.
Yeah, I was just talking about, just generally speaking, with the sort of flexibility to forgive a loan or to sort of have a mutually agreed interest rate or to confine the repayment to 50% of surplus. Just was not quite sure whether that ultimately, whether that is likely to lead to a high repayment percentage, because I know that we're assuming there will be a repayment for purposes of using that money again, but it also looks like there's a bit of a, pretty flexible type of arrangement. And in some cases, there may not be a source for payment. And then the final part of the question was just what happens if the project's sold, which is not uncommon with a developer.
So we look at it on the front end and underwrite it to ensure the project is realistic to expect the project to be able to pay back the loan. And we issue a deed restriction on the property. So if they violate the terms of the agreement, they still have to come to us to get that deed restriction lifted off the property.
Would the buyer have to pay off the loan at the time of the purchase?
Yes, they would have to pay off the balance on the loan before they could sell the property.
One other question I had that's a little bit unrelated is you mentioned an independent evaluation committee. Who will that be? Is that something that already exists, or is that something that would be formed?
We will have to form it. We will put together an independent committee based on each one of our applications, but we try to get folks who are familiar with the particular line of funding. So we'll probably have someone from Metro Homeless Impact Division, perhaps a developer, someone from the HPC Council, and folks who are just familiar with these types of loans and projects.
And then my final question is, it seems like that when there is a repayment amount, that there's some flexibility in terms of how that amount is used. And my question was, and I know it's all to support the homeless initiatives, but the question is, why wouldn't it just be put back into this, in effect, loan pool for purposes of continuing to generate more units?
It could be. It would be determined based upon, we go through sort of a community planning process each year with our annual action plan. So it would sort of come out of that process. And if there is an interest from the community to continue this program, we can allocate these funds back into this particular program. It would just depend upon what is the preference of Metro and the preference of the community.
Thank you.
Any other questions right now? All right. Amel, do you want to continue through the Q&A?
Sure. Is this new or different from existing MDHA programs or the Catalyst funds? This is a new program specifically because it focuses on creating units at 30% AMI and having the PSH set aside. It is also different from the Catalyst fund, which focuses on preservation of affordable units. So it is a different program. And I see Hannah back there in the back nodding yes. And we are working very closely with Metro Housing on these programs to make sure they don't overlap with each other. How do you guarantee the affordability time frame? What are the teeth? Can you provide an example? Again, we will enforce this with a deed restriction that we will file with the Davidson County Register of Deeds. This is similar to what we do with our home projects and some of our CDBG rehab projects. We file that deed with the Register of Deeds, and if the owner attempts to sell the property, they have to come back to us to have that deed released. Who are the developers? How will they be recruited? Can developers with worker safety issues be excluded? So we will target developers who've applied to THDA for low-income housing tax credits, or developers who already have an affordable housing subsidy award. We will recruit developers through an RFA process, and again, take those developers through that application process prior to making awards. The safety issue. So we right now we don't monitor worker safety, but there are lists of developers who are barred by THDA and developers who are also barred by MDHA. What we can do through the application process is request that developers provide us with their most recent OSHA report, and the evaluation committee can consider that report in determining the applicant's sort of credibility and capabilities of pursuing this project. How will the HPC be engaged in this process? We've already made presentations to the Homeless Planning Council. In addition, developers will be required to accept households via referral through the coordinated entry process. Please walk through the process. What is meant by program income? How is it used? How is it used, and what does the projection look like? So program income is for all practical purposes, is a HUD term, and it really just refers to the loan proceeds. When those loan proceeds are paid back to MDHA, from an accounting perspective, we consider that program income. I use the example on $18 million in loans awarded, with annual loan proceeds of $985,000 coming back to MDHA. Under this example, we would reissue that funding out through an RFA, through our home program, back out to developers. They would apply for that funding through this RFA process, and we would make awards similar to what we're doing through the GAP program, but we would sort of tie that to a home program. But again, that would all be determined through our action planning process and the feedback we receive from the community.
Are there any further questions? Yes, Councilmember Gamble.
Thank you. Thank you for being here and for your presentation. If we can go back to the question that referred to this program being different from existing MDHA programs and the Catalyst Fund program. This program targeting households at 30% or below, what is the MDHA programs that provide housing, affordable housing, what is the percent rate that they have? I know 80% median income for Catalyst program. Is that also for MDHA program?
For our home program, it's 80% and below.
Okay, and that's for all of your, like, Casey Homes, those type of housing options, it's 80% or below?
It's a little different. We are not awarding sort of funding to developers through Casey or some of our other envision processes.
Okay, so these are not MDHA apartments, so to speak. These are...
They're not.
Private industry apartments, okay. What is the percent for our MDHA apartments, median income?
I don't have that information, but I can get it back to you.
Okay, and also, do you have any information on how the population, the percentage or the number of population that this program could serve at this 30% median level?
We are anticipating up to 120 or 30 households that we'll be able to serve
120.
through this program.
Right, that's how many you be able to serve, but how many, what's the percentage or number of
People?
of the population that need, in that 30% median income, do you have that need this service?
I don't have it right off.
We have projections in the report, but I mean, Nashville really needs like 2,000 units yesterday.
Within that 30% and below
Well-
median category?
30% and below, I mean, when you take a look at your single, especially very young mothers with children, people on fixed incomes, all of that is really important. The subsidized vouchers, the set-asides for permanent supportive housing are also equally important because we have the resources to put people into housing, but we have trouble finding the units. So this is kind of a twofold thing. So this essentially serves pretty much the whole population that April is, working to manage, because each intervention is a housing intervention. It might not be a permanent supportive housing intervention, but we need the units to be available to move the needle here. And so the units, any amount of units that we can bring on, and your construction costs here are very high.
I believe the deficit in the Affordable Housing Task Force report was like 11,000, if I remember correctly, for 30% and below.
And the 150 families is based on just that amount and how many units you could provide with the amount that you're requesting.
That's correct.
Thank you.
Yes, Mr. Gonzalez.
So following on this thread of thinking, admittedly, I know very little about the nuance, the different programs and the nuance and the details, but what's in my mind is sort of more a strategic long-term question. So what I'm digesting here is there's a proposal for a request for $25 million, and what I'm hearing is that's going to ultimately represent about somewhere between 120 and 130 units, right? That's just a drop in the bucket. I'm attracted to the idea of doing something that's new and that's not been done here before and that's innovative. And yet, it's only a drop in the bucket, right? So I guess my question is more strategic, long-term. How will this create, if we're sitting here 3 years, 5 years from now, we look back and we say, that was a very important allocation from this pool of funds, and we have 120 units, we'll be happy about that, right? It's good, it's a success, but how is this going to be leveraged? How is this learning, or how is this experience going to get us to a point where we don't do 100, but we do 500 5 years from now, or we're positioned to do 5? And that might be a broader question, because that's not about the approval of this request, but that's what's in my mind for someone that doesn't, I understand there's enough due diligence about how the program will operate, but to the extent that this committee is charged with administer this pool of funds, that's what's in my mind. So I wonder if you can just take a minute or two to
I'll start and then Amal can finish. I think that is an excellent question. Every drop in the bucket matters, especially when you're dying of thirst. And so these units are very important. Also, the way this deal's set up, it's for projects that are already stacked and ready to go, and some may already be under construction, so it brings on the units sooner than being part of the initial funding stack for different agencies. But so this particular program we are going to use to leverage our application for the continuum of care NOFA in order to increase that. And if you read the report that went out, we get a much smaller amount than cities who are similar to our size. So we're going to use that to leverage that. The mayor's office and a number of us have been in conversations with TDHA to talk about getting them to add 30% units that are affordable to households at 30% to their QAP, which is their qualified allocation plan. And so we are looking at all sorts of different ways, and we need to be very diligent and have the will to continue to find the different opportunities to court new investors. I will say that a number of the people that apply for this could be chodos or the people that normally apply for home funding, and their job is affordable housing, and so that's their mission. So it's going to take a long-term plan and a long-term will, and I think this is the beginning of this. And certainly when Mel's team evaluates this, leverage is going to be a major thing. I mean, this is gap funding. So leverage in the number of units at 30% and the number of units that you're willing to say, hey, I'm going to set aside 10 units, like out of a 100-unit thing for PSH vouchers. And so it can actually make quite a bit of difference. Do you want to add to that?
I'll just add one part. Looking at the example from loan proceeds, we're looking at like $985,000 a year coming back in on an $18 million in loans. We get about $2.5 to $3 million in home funds, federal funds, for new housing creation. So this is a significant addition to that pot that we can focus for building more units at 30% and below.
Yes, Councilmember Sepulveda, and just as a time reminder, we're at 35 minutes into the hour.
The gap financing program, and it says being proposed in which the latter is meant to make funding available in existing projects to get deep affordability. Do we have addresses for those?
No, we will have those addresses once the developers actually apply to us for the program.
Yes, Ms. McDaniel.
So I have a question. I'm aware of developers that apply for these kinds of projects, but they require that it's credit enhanced affordable housing developments backed by HUD or FHA. Does this qualify under that kind of program?
Which HUD program?
It doesn't say. It says the fund requires that this be under the credit enhanced affordable. I guess those are underwriting guidelines.
Which section are you looking at?
No, I'm asking just a question in general about this particular program, and if there were developers that were interested in entering this process. Are these loans credit enhanced affordable housing development?
No, they wouldn't be.
Any other questions? All right. Based on the comments that Stacy made at the beginning of the meeting, we have two options. We can either move to take a vote now, or we can take all these up at the end still as individual votes. Since all of these have a deep interrelationship, according to Ms. Koch, are we comfortable with waiting and moving on to the next topic, or would you prefer to vote now? You all will make a motion either way, or if we were moving now. Looks like perhaps we'll wait, and that's fine. Why don't we move on to the next program if you're comfortable with that? All right. Housing First Supportive Services. Is that Stacy? All right.
Yes.
Thank you.
Housing First, as the founder of Housing First always says, is not housing only. The effective way and the way to assure that people are able to maintain their housing are to have supportive services that are targeted to each individual household's needs. And so for some of those households, they might need something called an ACT team, which is Assertive Community Action Team, and that is a multidisciplinary team that visits the household at their dwelling. It is a community-based service. We're not asking people to make their housing contingent on getting on a bus and running over to meet with their case management team. This is a team that comes to them that's highly skilled in helping people work through issues, and these are people specifically with serious and persistent mental illness, often combined with substance use disorders. One of the other forms of case management is intensive case management, and that tends to be usually one person, a case manager, along with perhaps some peer support that also provides support to the person in their home. You cannot expect people who have been formerly homeless, who have just been housed, to, hop on the bus and run across town to make an appointment. All of these services need to be community-based. In order to be considered housing first, the person has to be seen at a minimum of once a month, but that is not the optimal. What? Agreeing. Oh, that is not the optimum. I mean, we have some families that are seen that only require the minimal support to help them get connected to food stamps, if they are eligible for benefits such as Medicaid, to make that happen. So it's a number of different interventions that will be determined through the vulnerability assessment of each family, so that we are no longer throwing the whole enchilada at everybody. We are being strategic and targeting our resources to make sure that each person or family gets what they need, and that we make strategic use of our resources. Now, sustainability. As we know, Tennessee is not an expansion state, but we are hoping to put this out through a national partner to licensed Medicaid agencies who have the best opportunity to get reimbursement for these services. Once again, at the same time, to your question earlier about the housing, we have to also continue to work with the state mental health department to make sure that we get access to everything that they have, be very active in applying for SAMHSA grants, which stands for, they're part of, you're shaking your head. I don't remember what the acronym stands for, but it is the mental health and substance abuse of the U.S. Department of Health. So also, another thing that we have already started doing is advocating at the state level for a waiver, and we are hoping to get a 1915I. We've just begun discussions. We haven't started lobbying, but I mean, for all of you, and I'm happy to come and talk individually if you want to talk more about it, but a 1915I will make it so that even in a non-expansion state, that the people who serve homeless people on the streets that are serious and have serious and persistent mental illness, that the Medicaid providers can get reimbursed on an uncapitated basis, because currently, even through Medicaid, when it's reimbursable, there's a cap, and so, or capitation on the number of visits that somebody can have. And so advocating for these waivers is very important. There's another waiver called the 1915C that works with people who have traumatic brain injuries and orthopedic disabilities. I recently heard that those may not have been as effective, but I think it is our job to kind of advocate for it for all of these people, and not just here in Nashville, but the whole state of Tennessee. And I come from Louisiana, and at one point in time, we were not an expansion state. We had Bobby Jindal as a governor, and he actually is the one that helped us put this one through, in that he recognized the savings that the state would receive by making sure that these people weren't being transported weekly by ambulance to a hospital, picked up weekly by police officers for some minor felony, or that they weren't, clogging up the emergency room. So evidence shows that all of this saves each municipality a tremendous amount of money. Yes, ma'am.
Would you like to walk through I'm sorry, did we have a hand? Oh, yes, Ms. Finley, sorry.
Oh, I didn't know there were questions.
Yeah, just a question, it's sort of just a broad question in terms of identifying the people that are going to be helped by this program, and again, kind of looking at it about the number that we think can be helped in contrast to what the current need or demand is. And going back to your comment about Medicaid, I mean, it's one thing to talk about the grants going to providers that are, Medicaid providers or in the process of becoming Medicaid providers, but what about the people being helped and whether or not they're on the TennCare rolls? That's a component of it as well, presumably. So just talk a little bit about the population that we currently serve, the population to be served, and then what happens after 3 years.
So the whole purpose of a grant to build capacity is to give them enough time to not only start seeing what they can recap from billing, but to also begin to do their own fundraising. At the end of the day, there is no government, including the federal government, that can support all of the services. So it's important for philanthropy and other areas to work together to kind of fill in the gap. And we plan on doing a systems mapping to see where some of those gaps are. But I will say that if we were to get the waiver, then that would be very beneficial to making this even more sustainable over a long period of time. And also, very often, once you get to the point where you have effectively made chronic homelessness rare, and does everybody know what chronic homelessness is? I know it's people who have a disability and have been homeless for a year or more, or who have had 4 distinct instances of homelessness over the last 3 years that equal a year or more. Serious and persistent mental illnesses are the ones that take a tremendous amount of time to work through, and that is where the Medicaid waivers that will come in. And then for people that are on TennCare, it depends on their level of disability as to whether or not they would rise to the level of the waiver or even have the need for weekly. But many of them that are on TennCare already can be reimbursed through any of the Medicaid providers, right? Yeah. Did I answer your question?
Yeah, I guess the only other thing is just how do we identify who's going to be helped?
That is an excellent question, and I'll let April talk about coordinated entry.
Thank you for that great question. Let me scoot a little closer to the mic. So currently, the Homeless Impact Division, we have a coordinated entry program. You may hear it referred to as CE. There's a vulnerability index that is an assessment tool that they use in order to rank the client's or the person's level or acuity score. I don't like to refer to it as a score, but that's what we use at this point in time. So based on that score, we are able to capture those that are the most vulnerable, and those are the ones that our community strive to serve first with the funds that we have available.
Those are most often the people that you see walking the streets and living in encampments.
And they're reached and connected through outreach. And we have an outreach team, and there's several outreach teams across Nashville that help with providing and entering that data into the homeless information management system.
Yes, Councilmember Gamble.
Thank you. This is wonderful. It's something that we really do need, Housing First Supportive Services. Excuse me. I noticed in the proposal that you'll be using this funding over a 3-year period to provide grants to, in coordination with nonprofit healthcare partners. Are there any in particular that you are aware of now or that MDHA works with, or even with our Metro social service programs that would be ideal partners for this? Have we identified some? Is this something that we can start with right off the ground once we allocate the funding?
Yeah, I think that I know the Mental Health Cooperative currently has an ACT team that is in, I hate to say action, but that's what's going to come out of my mouth. There are a few other healthcare for the homeless clinics. Those are probably the best because healthcare for the homeless, they call it healthcare for the homeless, and the clinics are FQHCHs, federally qualified health clinics for the homeless, and they already get enhanced reimbursement from Medicaid. And you have, I believe, 3 of them, 3 FQHCs here, 1 FQHCH that I already know of, and they are all excellent candidates for this. And it is an opportunity for us to start braiding funding. You know, right now every agency is trying to do everything, and every agency really can't do everything, and they're going to exhaust themselves. And so it's really important that we learn how to partner in order to leverage everybody's funding.
Thank you. And with all of our other funding allocations, particularly for rent and mortgage relief, for example, with United Way, we track the outcomes of those services. Who would be the coordinating agency for this program to make sure that we're getting that data?
So the Homeless Impact Division, we have a local database here that all service providers will be required to enter their data into, and so that's what the coordinated entry is operated out of as well. And we have a lot of robust data. Almost all of the agencies, I'd say over 50 agencies currently enter into the Homeless Information Management System, and that would be the tool that we would use to track progress, data. It's a very in-depth tool, a nice case management tool.
Do you track any demographic data?
Absolutely.
Awesome.
Absolutely.
Thank you.
Great question.
Yes.
All right, Stacey, in the interest of time, I'm sorry, April.
I was just going to say, and we can bring monthly, weekly, quarterly reports back to you all. It's a very easy way to pull a report at the end of the data.
Just so you know, I've shared the reporting requirements already that you all have standardized with the team here, and so we would work that into any legislation and forward, particularly the ones that you created for the Barnes Fund and their reporting.
All right. There were questions last time. The first question is worried about sustainability of this funding, recognizing the need for how long this can help. I think we've already discussed that one. Is this rapid rehousing? No, it is not rapid rehousing, and rapid rehousing has, a finite subsidy. That said, there may be, especially if we're using rapid rehousing as a gap for waiting for a voucher to drop into place, and it is somebody that qualifies for permanent supportive housing, supportive services, that was a lot in one word, then, it would be paired with it, but it is very much different. Rapid rehousing is simply a subsidy. Oh, do I have more questions?
Yeah, a couple more. What kind of wraparound service?
I can't read that thing. What kind of wraparound services? Has there been any discussion of a reentry program? So I think I already discussed when I was explaining what the teams were about the wraparound services, but the question about there being a reentry program, I am so excited to announce that we just elected Dr. Laura Mims to the board, and she works in education and corrections, and we do want to start working and get a small group. She's very interested in doing a committee because people get tired of hearing me say this, and I wrote this into the New Orleans 10-year plan. The back door to prisons and institutions are the front door to the homeless system, and we need to find a way to divert people away from the front door to the homeless system. And so we're going to be working on a way to do that, because while we're working on housing chronically homeless people, which is very, very important, we need to keep all of our other trains chugging and communicating down the track. And the best way to lower the number of homeless people out there is to have a very strategic but robust diversion program.
One more question, Stacy.
How does it align?
That's all right.
Where?
I think you may have addressed it even in
you've got it
talking
there.
about the Homeless Planning Commission a moment ago.
What?
How does this align with the Homeless Planning Council?
Oh,
Yeah.
okay. So when MDHA created the home plan, the home ARP plan, they were extraordinarily diligent in interviewing the Homeless Planning Council, MHED, different agencies, community stakeholders. We use the information gathered from all those people. Further, all the information I gathered in the interview, the one thing that pretty much everybody agreed on when I interviewed them was we don't have really good supportive services and we don't have enough housing units. I mean, that was the mantra throughout. And so we're also going to be establishing a steering committee to kind of provide oversight, and of course the HPC, plus community stakeholders, plus council members, plus all the important partners will be a part of that. Is that the last question?
That's good, yes. Any further questions on support services? All right, we'll move on to the next one then. Stacy, temporary interim gap housing.
Okay, so once again, Nashville is probably at a 95% occupancy rate. Is that right? And then your affordable housing is even harder thing to get in touch with. So if we want to move people out of places that are not meant for human habitation, places that are actually very dangerous for people to be living, and allow them some safety and dignity, then we need to have some options for them. And so this fund is to create a multitude of options, whether that be mobile housing units that will allow 4 people to live together and each have their own separate, very small room, but with a locker and a bed, and each of the 4-bedroom units also has a washer and dryer and their own bathroom, so they're only sharing 4 people to a bathroom. It allows them to have some space to themselves and maintain their community. Also, hotels remain an option, and they will always have to be an option. That said, we realize that we have to do a better job of making sure that those hotels are staffed with security and program staff to create the relationships that are needed to help people move forward. We also have something called called the mobile housing navigation centers. And these are places that are set up within local churches. And some people will always choose those. But at the end of the day, everybody deserves choice. We all like having our choice of where we live and where we go to dinner and all of those things. And, these people deserve to have as much choice as we are able to give them. And it also allows us a better chance of bringing them to a place where they are safe enough to make good decisions for themselves moving forward. Do I have questions?
Yes, Councilmember Sepulveda.
Just curious, trying to figure out what our stock is of affordable housing. I know a while ago, this committee approved funding to create a software or to purchase software, I can't remember what it was, where all of the available units would be. So we could have that available to all providers at Metro. Was that ever created?
I think I see Hannah joining us from the back. Hannah,
hi, everybody. I'm actually happy to report the Catalyst Fund, which has been mentioned a couple of times here. The RFP for that closes tomorrow, and we expect to have a fund manager selected in August. So that's really exciting. The resident portal RFP has been a little bit more time consuming because of the technical aspects, making sure we have something that's broad enough so we can actually get a supplier, but technical enough so that we, have clear expectations on what we're paying for and seeking, and that RFP will go out in August. I will say from an inventory perspective, we did bring on a new data analyst to our team on June 5th, and so they will are working on that first iteration of all of the inventory. That will, of course, not be the same as being able to apply and kind of like a resident facing, but for the council and the administration and, our partners, it will be a place where they can navigate, see units throughout the county, how they were funded, what AMIs. It will be a great evolution for both our internal awareness of the effectiveness of tools and then certainly the council to get to see what's in your districts.
And you'll remember meeting Hannah Davis from our Housing Division of Planning Department. Thank you, Hannah.
All right, there was a question, can we comment more on very low barrier national best practices? Low barrier is a national best practice, and low barrier means that you do not require somebody to be sober when they come in. You do not require somebody to have a driver's license or an ID when they come in. You do not require them to commit to go to treatment. You bring them in. There are rules. You have to honor the safety of the environment and the neighborhood, but they do not, it's not like, you have to, or you can't, you don't have to go to chapel. It is come in, make this your place, your safe place for a while, and follow the golden rule. So that is what a best practice is. And then once again, as I talked about earlier, and I'm not going to read the answer as it's written, but people who are chronically homeless have a disabling condition, and they require some experienced help. And so even at low barrier shelters, you would have people that know how to slowly build a relationship. You can't meet with somebody the first day and say, oh, I see you don't have any shoes. You need shoes. No, that's not the way it works. You need to get to know this person because he may not have shoes on because he's got some sort of foot disorder. What I'm saying is you need to take the time to meet the people where they are and listen long enough to know what questions to ask. And that is the way that you create a relationship with somebody with a serious and persistent mental illness or a substance use disorder that has been resistant to housing before. You have to listen, you have to create a relationship, you have to build trust. And all of that can happen within a low barrier environment without making it a formal, you have to come to counseling right now. When I did this work myself, I used to sit down next to them on a step with a cup of coffee, or sadly at the time I smoked cigarettes, and smoke cigarettes with them and find out what was going on in their life and find out what they thought they needed and, you know, what did they want. And it was effective. So.
Yes, Mr. Gonzalez. Oops, sorry. There we go.
Quick question. So it's the term of the usage of this 9 million, is it 3 years? Mm-hmm. And so can you comment on the sustainability beyond 3 years on that? Like what the plans
earlier,
could be?
but so our best chance at sustainability is, of course, a Medicaid waiver.
So that's that is connected to the...
Oh, the interim gap housing. So we're hoping that, I mean, this is a tool for us to, you have about 400 chronically homeless people, according to our current point in time count. And so we are hoping to use this as an option, a short-term option, as opposed to building a shelter, which would probably cost about a minimum of $10 million to build, and then a minimum of $5 to $10 million a year to run effectively, depending upon the size. And so this is meant to be some of them a short-term solution to move people into the system. I mean, we are hoping that the landscape of Nashville's homelessness in 3 years is significantly different than it is today if we're able to bring units on, because you have great partners. MDHA provides 18 housing vouchers a month. If we have units to connect them to, we can start making a difference. And so the whole point is to try to find a way to make homelessness rare and brief. At the same time, we can look at the efficacy and the cost savings compared to the actual cost and see what is needed in 3 years. But it is hopeful that you won't need this whole enchilada. This may be something that you can manage in 3 years with some hotel rooms and the mobile housing navigation centers.
And this is why it's important to discuss how all of these funding sources kind of tie in. This is a short-term solution that will hopefully meet with the long-term permanent supportive housing solution.
Yes, Councilmember Gamble.
Thank you. On this page where it has the current point in time count numbers averaging 1,900 people, is that that's the current number of people that are going through this low barrier housing gap program?
No, ma'am. These low barrier housing gap programs are specifically for people who are living in encampments or in areas not made for human habitation. Your total 1,900 count comes from your unhoused, your unsheltered count, which is 650, I believe. That count keeps going up for you guys. So, but not all of those are chronically homeless. And then the rest of them are people who are experiencing homelessness. The majority of people who come in and out of homeless every year are actually able to pull themselves out of homelessness, and either through finding employment, living with family, but most people are able to pull themselves out. We want to interrupt that cycle where people become chronic and live in an encampment, and we want to, as Alex Smith, who is on the HPC, would say, we also want to intervene with the youth before they get to the point where chronic homelessness is what they see for themselves in their future. So it's a multi-pronged approach, but this is specifically for your unsheltered homeless.
And the 300 to 400, this assisting 300 to 400 of our most vulnerable individuals, is that per year, or is that over 3 years?
The 300 to 400 is the total that we have that are the considered the most chronic. So within the 3-year time period, hopefully a program like this will be able to serve and meet the need of all of them.
So them per year, so 300 to 400 per year.
Hopefully
over the
we won't
3-year
have 300 to 400 per year.
Yeah, hopefully the number will go down.
Yes.
Okay, thank you.
All right. I'll just, oh yes, Ms. Finley.
Just a quick question on the sort of coordination. On the Housing First support services that we talked about, how do those differ from the support services in the interim gap proposal? Because the interim gap housing proposal
They're
talks
all connected.
So in terms of if someone gets interim housing and they need support services, is the money coming out of the allocation and administered through the interim gap program, or is it then tapping into the other? And the reason I ask is just because it seems like they're kind of administered by different organizations potentially, because healthcare.
Right, because we are requiring partnerships that are actually integrated partnerships and collaborations. And, you know, in this case, collaboration is not just having lunch and talking about something. It's actually working together and integrating your services. So let's say April comes into one of the interim gap housing units, but April's actually kind of got a job. She ended up homeless because she lost her job and she showed up at work drunk. And so, sorry, April. And, and so she comes into the interim gap housing program. So she will be put in touch with the agency that best meets her needs. Given what she's just said, she'll be given some resources. She'll be certainly given a safe place to live. She'll work with a case manager that determines, you know, with April, whether or not she thinks substance abuse is an issue, or whether or not she was drinking because, you know, her boss was kind of mean, whatever. I mean, I'm being very simplistic about this. So April's like a quick turnaround. And then we have Mel, and he shows up, and he's got serious and persistent mental illness. He's also got severe diabetes, and he has been homeless for a really long time. The staff at whatever interim place is going to certainly call in one of these teams, but first they're going to develop some trust with him and get him to the point where they say, you know, Mel, I think this group over here can help you. We can get you into housing, but I need to introduce you to Susie Tolme, who, you know, is going to help you move through this process. Now, that person would be coming out of the $9 million, but April's person, not necessarily so. Does that make sense?
It does, and it basically, the Housing First $9 million and a portion of the interim housing $9 million will all go for sort of support services. They just will be, you know, which program that funding comes from kind of depends on the circumstances.
Right. I mean, and it says support services, but the truth is you have to have, in order for something to exist in a community, because residents of communities have rights too, and at the end of the day, we want all of our people that we serve to be integrated into a community. And so it's incumbent upon us to make sure that there is good management and good people working with individuals every day to build the trust in order to make sure they have the best chance of retaining their housing.
Thank you.
Thank you.
Any other questions? All right, just keeping an eye on time still, if you don't mind. We can move forward to the Low Barrier Housing Collective.
I made some notes in. Yeah.
You, April?
All righty. So currently, Metro Homeless Impact Division, we have a low barrier housing collective that is a landlord engagement program that is a collective across Nashville. Several nonprofits, faith-based industries actually utilize this system to help with finding housing for their individuals that were experiencing life without a home. Increasing funding for a program like that would definitely increase our staff capacity and the current capacity, and also increase bringing on new staff. What we hear from our partnering agencies is that they're asked to be everything for that client. So that means if they're running a shelter, they're actually doing intake, doing management and case management while they're there, making referrals to resources that are available, then finding the housing on the other side, and then connecting them to that landlord and moving them out. So some of these funds will help with that. Definitely the Low Barrier Housing Collective Fund would help with that. So increasing to have 2 to 4 housing navigators to help across Davidson County will help increase the agency's capacity much more on a macro level. So instead of doing one-on-one with the client for a Section 8 application or going to look at and view an apartment, they can take 5 of them at one time because they don't have the intensity of the full case management for that client. So it just helps to expand the capacity of the client, of the agencies around as well. Also, what this will help with is bringing on landlords and property managers and large developers to incentivize their opportunity to be able to help our clients by lowering and reducing barriers. So when I say lowering and reducing barriers, a lot of apartments, you have to have 3 times the income in order to qualify for that unit. You have to have a clean background check and credit. So the Low Barrier Housing Collective incentivizes landlords to accept our clients by reducing those 3 barriers and providing housing for them. So that's what the landlord incentive is as well. What's huge for this fund would be 2 things that I absolutely think that our community would need assistance with is damage indemnification. So if someone left a property and damaged the property, then this can help. But also there's some small, I call them mom and pops, but they may not want to be referred to that, but there's some small property managers that have units that are actually offline because they did not have the money to paint the walls or to pull up the carpet or to put in the new flooring. So this will help to get more units online as well. The other is education. So educating and training, this is where that support services will come in as well. Educating and training, whether it's the client on knowing their rights, how to be a good tenant, whether it's the landlord or the property manager on who to access and how to get help if our clients are in need, and then also the organizations that are making these referrals. How do you make good referrals? How do we help them with training and educating the clients and the agencies and the landlords all together? So this fund will help with all of those. I'm not sure if there was any questions, but a couple of things that I do want to note. Stacy discussed our clients, sometimes they're able to write themselves. We pulled a report today and shared it in HPC, and just shy of 1/3 of the clients that experience homelessness sometimes are able to afford the rent on their own with no ongoing subsidies, but they may need a landlord that's willing to give them a chance. They may need they may need our funds to help with the deposits and incentivizing a landlord being able to give them a chance. So this pot of funding will help with that.
I believe Councilmember Sepulveda has a question.
Yes. So wanting to make sure that people without Social Security numbers are able to receive housing, and that the landlords themselves know that we are not requiring Social Security numbers.
That's a great question. That definitely can be a requirement that we put in our information. And, you know, some of the landlords are a little bit different. They all have like a requirement on the back end. They may reduce 3 barriers, but not the 4th. So definitely we can use that as something that we incentivize the landlords with as well.
Any other questions? Yes, Ms. Finley.
So just to confirm, the $3 million the program manager and the 2 to 4 housing navigators, those are going to be housed in Metro, that will be their salary costs, or?
I think they would wish that would be their salary costs, right?
Yeah, well, no, I don't mean it's
Absolutely
fully, but
not.
that's going to include that, is
That
what I'm
will
asking.
include,
Yeah, no,
yes.
I wasn't suggesting they're going to make $3 million. I'm just suggesting, I'm trying to get a sense of, part of this is going to be kind of recurring employment costs.
Yes.
And then part of it will go to this checklist of items.
Yes,
here.
absolutely.
Okay, thank you.
Great question.
All right, I don't see any other questions. So April, why don't we move to the last one, competitive grant funds?
Very good. This is huge. This is how we create community buy-in. This is how we create collaboration, the braiding of funds, all the things that Stacey's already said. She didn't really need me to say this, but I'll just say that this is, we currently have agencies that try to make, thank you. We currently have agencies that try to make 150 pennies out of every dollar, sometimes 200 pennies out of every dollar. So that means as they're squeezing that dollar or that nickel or that penny, that what sometimes is first on the chopping block would be education for their staff, training for their staff, trauma-informed care training, critical time intervention, all of the trainings that are best practices that we know of that helps move the needle in homelessness. This will help with creating true high fidelity to housing first. A lot of agencies here in Nashville may say they know how to do it, but this will help get them trained up and bring some innovation and progressiveness out of the agencies that we have now. So it's a competitive grant. I think with $4 million, between 6 to 10 agencies could apply, but they would have to be more innovative in expanding their capacity and education and level of support that they're providing their clients.
Yes, Councilmember Gamble.
Thank you. How are these grants different from the Housing First grants, and how much would be allocated out of the $9 million for the Housing First towards grants?
So the Housing First grant that we discussed earlier, the way that this is different is that this is for the nonprofits that are actually providing that service and helping them to train and expand their capacity. So think of it as educating, training, or even coming to full scale. There's a lot of agencies that won't come to full scale as far as onboarding staff because of income or finances. So this will be more of an internal. And then Housing First would be the external component.
Right. A lot of these are not Medicaid providers, and we're not asking them to provide Housing First supportive services, but it's like when we set up the mobile units, and even when we look at adding staff to hotels, you want to make sure that you have people there. When I ran a large shelter, I called them resident advisors, and when I ran psych hospitals, we called them psychiatric associates. And more often than not, those are the people that see your clients every day and need and often have the most impact on their lives every day. And so you want to make sure that you provide them with all the training and support that they need.
Would this include organizations that do reentry programs for convicted felons, for example?
Yes, ma'am.
Okay. Thank you.
It's a big deal.
It is.
Any other questions? All right, then I think we're through all of the 5 programs that we wanted to take a look at. Councilmember Johnston is the one who originally requested that we break these down into 5 votes. So honoring her request, we can certainly proceed with that. One note she sent to me, she is out sick with COVID, but she wanted you all to know as a committee that she spent some time also going through we offered one-on-ones, a one-on-one, and she is supportive of the programs in front of you and has offered, should we need a sponsor for any legislation, to do so. So as we come to that, I'll ask her, Councilmember Pierce, to reflect on that further. I think I see a hand sort of there from Councilmember Sepulveda.
Okay. A couple of things. I think first, I feel much more comfortable with a lot of this proposal after hearing more of the details. So all that being said, I'm gonna pivot a little bit away from that specifically, because you all just received a press release from the Minority Caucus that went out earlier today. And since our chair isn't here, I'll speak to that specifically. Many of you all weren't present at the last meeting or had to leave early. And at the last meeting, we had Mayor Cooper come before us and give us a proposal from his office on priorities. And there were several concerns from council members, and this letter specifically is from the Minority Caucus expressing a concern with the way that was handled and with the survey not being taken fully into account. We also received the list of proposals that we still haven't heard, which equaled about 88 million, if I remember correctly. If we approve all of Mayor Cooper's priorities, that would leave us with 14.8 million to play with for the other nonprofits that haven't come before us. And that's including this 50 million, the Fisk Entrepreneur Center, participatory budgeting. Yes. And so that's what was before us, presented at the last meeting without us voting for it, since the funding still hadn't come in. We still haven't funded the other half of the right to counsel for evictions, and we haven't funded the other half of the immigration legal services, right? And we had said that we were going to fund that. So we haven't done any of that. I want us to take all of that into account as we move forward, because things don't end here, right? They go before the council, and then we debate it, and there was council members who were concerned. I think that we need to slow a couple of things down. However, I am comfortable with funding, I think, most of this today. Me personally, I don't speak for the entire committee. I did speak a little bit for the Minority Caucus as a whole. I just want to make sure that that was stated and that that is put out there. And I will let my colleague, Councilmember Gamble, speak, because she is also a part of the Minority Caucus. And I think she feels similar, that a lot of this needs to go ahead and get funded today.
Councilmember Gamble?
Thank you, Councilmember Sepulveda, for bringing us to this moment. I too agree that your presentation today really provides the meat and the substance that we were looking for in making any judgments. And I'll speak for myself. I don't know. I know some of the other committee members expressed the same concerns at the last meeting. So with that said, I'm open to a discussion now to discuss this proposal as a committee and see how we want to move forward with funding it. And I'm open to hearing from other committee members to hear your thoughts on that as well.
Yes, Ms. Finley.
Yeah, I would just make a comment and concur that I feel like that the additional detail provided today has been extremely helpful in terms of trying to understand what we're trying to accomplish. You know, a recurring theme all along in this process has been wanting to have something that is sustainable. And I guess, you know, if I could draw it up, you know, there was a reason for my question about why are the loan proceeds not put back into affordable housing. We're not going to reach a point where we never need that anymore, because then you're continually creating some sort of permanent addition to the housing situation, as opposed to having things used on temporary needs that, not that they're not incredibly significant. I'm not trying to diminish their importance, but this is such an unusual funding. You'd like to have as much that is sustainable as possible, especially if you can kind of continue to reload a fund. But all of that said, I do feel like I'm reading this press release, and I certainly, understand what our council members here have indicated. I'm not sure that the process that we have heard today is different than the process we've heard for our other funding requests. I feel like we've gotten sort of equivalent information. So I guess I would like to ask, you all, as a committee, if there are things that you feel like, or parties that you feel like that we should hear from before we make a vote, then I would be interested in hearing that. But I don't feel like that the scope of information that we've received for purposes of making other votes for funding requests, particularly on an issue that I know ranked very high in our community survey, which was homelessness, I don't, I'd be interested if there is a basis for delay, because I'm not sure I see one. I feel like we have gone through fairly comparable vetting.
Councilmember Sepulveda.
Yeah, I would say not this one specifically. I think the other requests, right? Like the Fisk Entrepreneur Center, where was that in our survey? We didn't necessarily discuss participatory budgeting in our survey. Sure, that we could argue that a lot of those priorities could be met in these meetings across the county. I think the way that this reporting, this proposal was presented to us is the same as all of the other proposals. I think the difference that we're stating specifically in this press release and other council members have commented on is the way it was presented to us, right? With the mayor coming, having a press conference and putting that before us in this manner. It is priorities of his office more so than not. And the way that could be depicted, where it's a lot of pressure being put on the committee as a whole to go ahead and approve everything that the mayor's office has put before us. That is what is being referenced specifically in this press release.
As moderator, I guess I want to see, is there a desire to move forward into a vote today on any aspect of these programs, or further discussion, of course? Yes, council member.
Yes, I think there's some discussion about wanting to hold off on the first 25 million. Is that still the case? Okay, we're all good. So I'll make a motion to approve all 5 of these funding requests. Is it 5?
Yeah, there are 5.
So the totaling 50 million.
Totaling
Correct.
50 million. We have a second from Councilmember Gamble. Is there discussion? Oh, yes, Councilmember, sorry. I'm sorry, Ms. Finley.
Yeah, just to clarify, what you're saying is the motion is for everything other than the loan program for housing.
Councilmember Sepulveda. Oops, there.
It's for all of the funding requests in here, in this packet. This is for 50, yes. The motion is for all 50 million in this request from the homelessness ARPA Year 2 funding request.
Discussion? Oh, yes, I'm sorry, Mr. Udabago.
I've got a couple questions just to kind of help level set things for me. Unfortunately, I wasn't here for the last meeting. It's my understanding that this proposal currently before us is, which was, I very much appreciate the presentation. It was very well done. It's a great idea. But my question is this a part of the $80 million proposal that the mayor requested? I'm confused about that.
I'm afraid I have not seen this letter, so I'm not sure what the numbers are being cited, but I do believe there's 50 in this program, and then we also did Q&A last month on affordable housing, which we would bring forward in August. Oh, I see hands up from people who might be more familiar with this letter. Just a moment. Yes, okay, yes, Councilmember Gamble, thank you.
Yes, at the last meeting, it was presented, the mayor's request was presented to us as one big request. What we ask is that it be separated and that we get presentations for each line item separately. So what we got today was the presentation for the homelessness part of his request, which is $50 million, and that's the only thing we're considering today.
Oh, yes, okay. Sorry. Mr. DeBago.
Thank you. That's very helpful, because my next question was, is there a process that we're working towards with respect to bringing the other parts of his request before the committee? And my understanding from what I read in the letter is that vetting the proposal is it's a major concern, as it should be. We've been very thorough with everything that's come before us. So I know that there are a lot of requests, but it sounds like maybe, at some point, those things will come before us in addition to everything else that we are entertaining.
Yes, Representative Love.
And just for some clarity, I believe that the entire package we've been given today, all these pages, is more than 50 million, I believe.
No, the pages, and it's probably because there's multiple pages for each one, but if you look back at the agenda page, perhaps you could go back to that. I think the amounts were on it, as well as the agenda itself. You'll see how the 50 million adds up, but it is a total of 50 million.
But the reason I ask is because once I get to the page that says AFGF Program Q&A, the next page says Housing First Supportive Services.
Yes.
So that's just broken down, that 9,000 is broken down?
So the deeply affordable, the what the acronym you have is 25 million.
Sure.
And then there's another 25 million of services programs. Housing First Supportive Services is 9, temporary interim gap housing is 9, low barrier housing collective is 3, and competitive grant funds is 4. So those two 25 millions together equal 50.
Thank you, I got you. So it's broken down.
Yes.
Thank you.
Yes. And to answer the prior question, I believe, without going into further commentary, last year you also received at the very beginning of year 1 funding, I brought it to you, and a suggested agenda of funding items to vet. And those were ones that we didn't come out with the same answer at the end of the day. You all went through a vetting process as you did. Every single item that has been proposed is expected to be vetted by you. And that I believe last month there was a calendar item suggested next to it that just said we would start off with affordable housing and homelessness, and that the others would follow, but there would absolutely be vetting of those proposals. So I just want to be clear at least that there isn't, whether or not you determine to move forward on those, there was never contemplated anything other than absolutely the committee vetting any proposal. I believe we have a motion on the floor, though, and we've moved off of the topic itself, which was for the $50 million for these 5 programs, ultimately. Is there further discussion? Yes, Mr. Henry.
Just fast clarification question. I assume we're going to fund this, by the way. Wonderful job, and thank you for doing it. After we fund this, if we do, what is our balance? Is it about $53 million after this?
So you have 129 million from this year, plus I believe there's a remainder, there's a report up front that has about 60K from last year's. So it would be the 129 million less the 50
million. So this is the first tranche of funding out of the new 129?
Correct.
Okay, thank you.
That's correct. Yes. Oh, yes, Mr. Gonzalez.
Yeah, I guess I want to get back. We do have a motion on the floor to vote on this. I'm a little confused by the timing of this letter that we've received right in the middle of this vote. I appreciate the merits of it and want to learn more about that. I understand that, but we have a motion. I also was not able to be here the prior meeting, but watched some of that presentation, reviewed some of this material prior to, went through today. To me, that feels like it's very similar to the process of what we've done. And certainly, it's a large ask. I like, in a way, the fact that there's a focus on one thing, and it's a large ask, and it's a focus on one thing. Because I wasn't here last time, I feel like I haven't had enough time to digest it all. But I am satisfied with what I read, watched, and then heard today to vote on this, if the rest of the committee is okay with taking the vote. And I think because there's a motion, then that's what proceeds.
Any further discussion? All right. Well, the motion is, again, to be very clear, it is for $50 million of homeless funding as proposed. It is across these categories that are on the slide here. $25 million for deeply affordable and permanent supportive housing gap program, and then $9 million for the Housing First supportive services, $9 million for the temporary interim gap housing, $3 million for low barrier housing collective, and $4 million for competitive grant funds to local nonprofits. If there's no further discussion, we'll go ahead and take a vote. All those who approve, raise your hand, please. Okay. All those opposed? None. It looks like it's unanimous. So we'll record that, Alex, properly. All right. Well, thank you very much. I appreciate that. We have one other touch point on our agenda, which is other business. I mentioned this last time around. For the Affordable Child Care Program, we've had a request that came in, and it was a little bit, I think, premature. We're still working on it, which is United Way is evaluating Mother's Day Out programs as options underneath that affordable housing, or sorry, affordable child care program. And if they determine that they would like to bring Mother's Day Out programs as well as licensed child care programs forward, they're going to come back and report to us on that before they take any action. So that's more of an update maybe from a process perspective at this point in time, as United Way is still going through its diligence. Any other business or topics? Yes, Councilmember Sepulveda.
Can we add to the agenda for the next meeting the remainder of the right to counsel funding that we hadn't taken up because we didn't have the second half of the funding in? And then how do we go about, as a committee, figuring out which nonprofits we want to hear from?
So Mary Jo circulated the list of nonprofit asks, or the total number. It's not just nonprofits, actually. If you look, there's other entities in that list. And her intent was for you to review that and to bring that forward in some discussion. She did not want you to only have 24 hours to look at that and think about it. So I think that'll be in August when she is returned to facilitate that discussion. And your request is noted. Thank you, Councilmember Sepulveda. Any other comments or questions? All right. I don't know if you do a motion to adjourn usually for these meetings, but is there a motion to adjourn? Seconded? All right. Approved? All right. Thank you very much. Appreciate your time today.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.